temp anymore. You've been here like 5 or 6 months, so a long-term temp. But we're gonna get you adjusted today. So we're gonna just show you chiropractic adjustment. Go ahead and lay down for me. Okay, Chili. Scoot down just a little bit. Good. So Chili, when she first started here, never had any chiropractic care. She's had few adjustments, and she has some unique symptoms that are alleviated with an adjustment, having to do with her eyesight. Things get brighter, more clear. The reason for that is right up at the top of the neck, where she gets, I can tell when she needs an adjustment, her eyes kind of droop and get heavy. She gets tension headaches sometimes, and some neck pain and neck stiffness. So the adjustments help her out immensely. And we have one other patient that notices it right away. Right after an adjustment, his eyesight gets brighter and more clear. So you and Tom have those sort of alleviation symptoms, right? So she also has some back pain. And we're just gonna loosen up the muscles. This machine just loosens up all the muscles, the tight muscles, activates the muscle spindles, and just relaxes the muscles. And we're able to get an adjustment in much easier. Some people, they find it tickles. Does it tickle? Yeah, I can see her wiggling here. She's like squirming around. If the patient squirms a lot, we strap them in. We don't let them move at all. But it's a fan favorite. People love this machine, and it's really effective. It can do, 20-30 minutes worth of stretching in literally a minute or two. So we're just loosening her back up. All right, we're strapping her in here. So, do a little bit of Cox flexion distraction technique. It's for people with degenerative discs, disc herniations, bulges, spinal stenosis, any chronic disc cases. And we're gonna distract the table out a little bit, stretch her out, open things up, decompress the discs, and just do some gentle flexion distraction before I adjust her. How you doing, Chili? I don't know if you guys were paying attention, but her eyes were like half shut. It's also been a really, really long day here at the office. And
I always know when I need it because my eyesight was not good when I have a headache.
you have a headache today? Okay. All right. I'm gonna you'll see the table here come back in. Just gonna bring it in a little bit. And look at this, one leg shorter than the other. Come on over here, I want you to take a look at this. So if you look here at the heel, this heel is shorter than this one, probably just by, about a ½ inch right there, okay? So that tells me a lot about what's going on with her pelvis, and sure enough, when I bend her legs, this leg, the same short leg, doesn't bend as far. So I know her pelvis is pulled back on this left side, which is her pattern. So let's have you lay on the right side. Face me. And deep breath in. Blow all the way out. Okay, crunch. Other side up. That's just gas being released from the joint, not bone on bone, like a lot of people think. Okay, we're gonna straighten this leg here. And relax here. Good. Lay on your stomach again. How's that feel now, just laying down there? Less
Maybe,
pressure?
Yeah, because my back was hurting too today, like down here.
Okay.
It's already eased it.
Okay. So, some people like getting adjusted, but without the cracking noise. They're afraid of that. They're nervous for whatever reason. That's fine. We know our chiropractors do hundreds of different techniques. Some of them involve cracking, some don't. Again, that cracking noise is just gas being released. It's bouncing off the synovial fluid and making that popping noise. Okay? So we have a lot of different techniques we can use where you don't hear any cracking, there's no twisting of the neck for anybody that's concerned or worried about that, or for somebody that might have a condition, a contraindication to a specific type of adjustment. Again, hundreds of different gentle techniques for the neck, and this is one of them called Thompson technique. It's something that I specialize in and been doing for 20 years now. One of my favorite techniques. Just relax here. Nice and easy, nice and gentle, and the only noise you hear is the table making that noise. And the top bone here has a optic nerve that goes right to the eyes, and that's the connection between the clarity and vision right after an adjustment for her, and also, you know, helping her with her headaches. Okay, go ahead and sit up and face the foot of the table.
Yeah. My eyes are already turned.
Well, it should get even better here. Do you have a headache right now? No? Okay, so we're gonna do a thoracic adjustment here. And tuck your chin, and I'm actually gonna have you scoot forward a little bit. Yep, okay. Tuck the chin, deep breath in, and blow out. Okay. Slide back. Okay. Now, just checking her neck here. Sometimes she needs this type of adjustment. She doesn't usually have a problem with it. Just wanted to show you a technique that we can use for people that don't like their neck cracked. And for those that do, we're going to show you this adjustment here, okay? And relax yourself here. Okay. Really gentle. Okay. Hands up in the air. Okay, look at this. So her hand here, you can see, this hand is much shorter right there when I stretch him out. I know she doesn't have a shoulder problem. That tells me a lot about what's going on with her psoas muscle. Psoas muscle is a muscle that attaches to the side of the spine and attaches even onto the sides of the discs in some patients, some people. And when it's really tight, it can help pull a disc or slip a disc and really aggravate back pain. So it's really important to check the psoas muscle for anybody that has back pain. It's like making pizza without putting cheese on it. Anybody that has back pain, the psoas should be checked. And this muscle here is the action of forward and lateral bending. So you're bending down to pick something up off the floor, or if you're just bending over even slightly to get your toothbrush off the counter or something off the desk, Every time you bend to that side, you're contracting that psoas muscle. So we have one on the left and on the right. And hers is tighter on the left. So you saw that arm test, you saw her right arm shorter by about an inch or so, maybe a little bit more than an inch. After we do this, we're going to test the arm again, and you'll see that it balances. Okay, and this is the only way to get to the psoas muscle. There's no other way, through the front. So if you have back pain and your chiropractor missed this, no bueno. Hands up. And come on and take a look. Now look, it's better, but it's still not perfect. You can see this hand is shorter here a little bit. So we're going to release it a little bit more. It's actually really uncomfortable. It's probably the least favorite part of the adjustment. It can be really uncomfortable and painful.
Do you notice
And I recommend you you go to the bathroom first and get everything out of the bladder, so to speak. Okay. Also, can be really helpful for people with cramps, menstrual cramps. Very effective, and it's balanced. You're all set.
Thank you very,
You're welcome.
very much. Do you see the difference in my eyes now?
Yeah.
Yeah,
You look more awake.
Yeah.
Even.
my eyes are open. I can see the blue.